Okay, today we're going to talk about prostates, and I'm talking about the blocking of the prostate when we need to pass a catheter. Okay, so you're about to catheterize a patient. With women, we all know it's about having enough light and the best positioning to see the urethra. But with men, you know it's often about getting past the prostate, especially in our older gentlemen who may be even having retention problems, but their prostate has started to enlarge. In this video, I am not teaching you how to generally catheterize someone. I'm assuming you already know proper sterile technique for both inserting and assuring that there's careful anchoring. So, how can we make it easier? Here's a few tips from our experience and from a couple of our local urologists. First, make sure the patient is as comfortable as possible. And perhaps if they have any problems with pain or agitation, perhaps you have had them pre-medicated about 30 minutes prior to the attempt so they can be more comfortable during the process. If you expect or know that this patient has had difficulty being catheterized, consider getting an order from your hospice provider for lidocaine lubricating jelly. This can be squeezed into a sterile 3cc syringe, and then holding the penis fully erect, you inject the amount into the shaft of the urethra. And then, of course, wait for about 10 minutes prior to attempting the catheterization. We all know lubrication is extremely important, and sometimes the amount supplied in most of the cath kits isn't enough. So you can use the same trick of filling a sterile syringe with plain sterile lubricant to fill up the urethra and assure there's lots of lubricant to get by the prostate. Have the patient be supine, bend knees very slightly, and support the knees in a slightly flexed position, as I said, with the legs apart. Of course, hopefully you have chosen the correct catheter, and that would be a coude tipped catheter. And this is the kind that has a bend at the tip, which helps the catheter slide under the prostate. When you go to introduce the catheter, use your dominant hand for better motor control. Make sure the tip of the catheter is pointing straight up to the ceiling. Okay, once you've inserted it, if you find resistance, don't force the catheter, but gently put a gentle pressure as you twist the catheter, and hopefully that tip can be coaxed around and under and by the prostate and end up in the bladder. So let's say you did everything right. You were using a 16 French catheter, and often the first inclination, if it didn't work, is to reach for a 12 or a 14, a smaller catheter. But our urologists here say, no, go to the next higher size. An 18, which would be slightly more stiff, and it can often push by instead of just getting curled up by around the prostate. Also, here's another technique I've never used or heard of, but a urologist says it can often work. You take a smaller catheter, and this happens to be a 14, and you bend the tip back about 1 to 1.5 inches, and then you directly insert the tip into the urethra, and then supposedly when it gets up to the prostate, boing, it just pops open and goes under the prostate. I always breathe a sigh of relief when I feel it slide in and I see that return of urine. Make sure it's well anchored to avoid urethral and bladder trauma if it got pulled on. Voila! That's it for our tips for easier catheterization of male patients. And of course, you're going to go back to our website, the Hospice Care Plan, get our booklet, and go back to our YouTube site, the Hospice Care Plan, for so many more good tips at the bedside.